Hi, this is Scott Morgan. This week I'm talking about mitral annular disjunction. These are my first two cases of mitral annular disjunction, or MAD. The first one was a very technically difficult patient due to large breast implants. The annular disjunction fit perfectly into her clinical pathway and scenario. Previous echoes had not mentioned this issue, but she had documented runs of SVT and was being treated with medications. Once you see the area on the ventricular side of the mitral annulus, you can't unsee it. It jumps right out at you. Such a big difference from this normal example. She had very tough views from the apex due to the implants, and it is difficult to see anything really abnormal. But the parasternals were pretty convincing in this patient for mitral annular disjunction. These stills from the article show what it can look like from the parasternal views and apex. The measurements are when the separation is at its greatest, usually at end systole. She did end up getting an EP study, and then they proceeded to do a ventricular ablation to finally stop the VT and SVT for her. This patient presented in a very different way from the other one. This patient was not symptomatic in any way. His murmur had been picked up in high school, and he was just establishing care with an adult cardiologist. This MAD echo presentation was much more typical. His glass chest also helped me out. He declined to have any additional testing done at this time. A monitor would have been helpful to see if any ventricular arrhythmias were occurring, and he admitted to no symptoms. The mitral valve prolapse is noteworthy, and the MR is one of the more sweeping jets I have ever seen. I suspect that this is part of the unstable annulus. It is much easier to see the mitral annular disjunction in multiple views in this patient. Check out the large amount of info available online in multiple publications, and keep your eye out for MAD. I'll bet you see one soon.